my name is Ivy Leslie. This is my visual aid for my persuasive speech. And let's start. Did you know that 1 in 4 adults living in the United States has experienced a mental illness or reported getting treatment for a mental illness? According to the National Institute for Mental Health, that means that 25% of Americans over the age of 18 need some form of mental health or substance use treatment. Does someone you know and love suffer from something like this? Have you ever had to worry about the cost of mental health treatment? There are people in this country who have to choose food or their medication because of how high insurance companies make copays. But there is a policy that has improved the cost and coverage of mental health and addiction treatments. That is the National Mental Health Parity Act. The Mental Health Parity Act is crucial because it ensures that individuals with mental health conditions and substance use disorders have the same access that people with physical illnesses do, promoting equitable health care and improving overall well-being. You're probably wondering, why does this matter to me? Well, for the last 10 years, I've been battling a severe mental illness and insurance companies because they don't like to cover things that are expensive but work. Today, we're going to discuss how this act ensures equal access to care, reduces stigma, and promotes public health. And finally, how the act addresses mental health and addiction crisis in America. So let's dive in. How does the Mental Health Parity Act help address equal access to care? It protects group health plan insurance participants from facing greater restrictions on access to mental health benefits compared to those who are seeking treatment for physical illnesses. Your medical benefits include if you need to go to the doctor for, say, you get the flu or you need your appendix removed. The mental health side of it is if you need to see a psychiatrist, a substance abuse counselor, a therapist, or get medications. Before this act, mental health benefits were highly restricted and imposed higher deductibles and copays, requiring stricter prior authorizations, meaning a lot of limitations on care for patients who truly needed it. The Mental Health Parity Act, along with the Affordable Care Act of 2010, requires that group health plan insurances give access to care and ensures that mental health services are essential health benefits. Now let's talk about the stigma that is mental health and substance use disorders in America and how the MHPEA helps reduce and promotes public health. When asked, several people said that the topic of mental health makes them uncomfortable because they didn't grow up with a positive viewpoint on this topic. That is a societal stigma from prior generations. By enforcing mental health parity, this law validates that the mental health is just as important as the physical health, thus reducing the stigma. Equal coverage of these benefits encourages people to seek help earlier. And the earlier they seek help, the sooner they start feeling like productive members of society. When people are diagnosed sooner, they regain control of their lives. Untreated mental illness can lead to some pretty dangerous situations for not only the patient, but for the people around them as well. Finally, let's talk about how this key element is addressing mental health and addiction crisis in America. The U.S. is facing rising rates of mental illness and addiction And the Mental Health Parity Act is a key policy that expands access to evidence-based treatment. Investing in mental health parity lowers emergency rooms visits, incarceration rates, and loss of productivity, which benefits individuals, families, and the economy. When people cannot access proper mental health care, they often end up in EDs, jails, or living on the streets, which are all places that are not properly equipped to handle someone in a mental health crisis. This law requires that services be on par with physical health benefits. So if someone gets unlimited appointments for their diabetes, they would also get unlimited appointments for substance abuse counseling or treatments needed for their mental health issues. This law increases the number of people who seek care for mental health and addiction issues who could not previously afford ongoing treatment. This law also helps individuals be diverted from emergency rooms, taking the strain off of first responders, law enforcement agencies, and hospitals, and gets them into the clinical care that they actually need. The MHPA is a step towards mental health equity and ensures that all individuals, regardless of their diagnosis, receives proper care. So now that we've learned how the Mental Health Parity Act addresses equal care, reduces the stigma of mental health, and promotes public health, and addresses the mental health and addiction crisis in America, we understand that the Mental Health Parity Act is crucial because it ensures individuals with mental health conditions and substance use disorders have the same access to care as those with physical illnesses, promoting equitable health care and overall better well-being. I want to leave you with a quote from Brittany Burgunder. Not all battles are visible, and not all victories are either. As someone who has battled mental illness for 10 years, I understand that this is a victorious policy and needs to be protected so that people like me are protected from insurance companies. Thank you.